All right, thanks. Hi everyone. It's nice to see you so early in the morning. I hope everyone has had their coffee. So my teammates Debbie Nguyen, Sophia Tan, Soham Sheth, and I are super excited to present to you our solution that addresses geriatric nutrition called Eat Right. So we'll be presenting Eat Right today in three main sections. First is context, where we'll give you a background on the problem. Next, we'll go into product, explaining key features and where it fits into the market. And third, we'll review the fun stuff. Well, fun depending on who you are, the finances. So let's dive into our problem. The most disease-stricken and fastest growing demographic in the US are seniors who are age 65 years and older. And that number is expected to almost double in less than 20 years. On top of that, 84% of this demographic has at least one chronic disease, and many have more, which consumes 80% of healthcare dollars in the US. So clearly, this is a super important population to pay attention to, and yet we don't do our seniors justice. A lot of this stems from poor geriatric nutrition, which means a huge bottleneck in reducing chronic illnesses and healthcare expenditures. So why do seniors struggle with nutrition? We thought this was best highlighted by our patient stories. Mr. Timothy Jones wants to take his nutritional health into his own hands after hypertension diagnosis, but became confused by navigating the technology and vast amount of information out there. Mr. Matthew Wong experiences lightheadedness and balance issues, and so he attempted to create a food calendar to make sure he was properly eating, which is a difficult task for a 73-year-old, especially if he experiences memory loss later on. And finally, Ms. Celia Fernandez experiences severe loneliness, which led to long periods of time in bed and a severe lack of desire to eat, which unfortunately resulted in a hospitalization.
And we aim to address all of these issues through our Eat Right service, which is a telehealth platform that empowers seniors to take control of their health. And our value proposition is nutrition for seniors made easy. We aim to do this through tailored nutrition recommendations with printable weekly grocery plans because eating healthy starts with healthy ingredients. We offer personalized support with a dietitian, and we keep senior friendliness in our design. And go into the design for seniors aspect of our service. As you can see on the right screen, our app has a larger font size and we offer simple icons for easy navigation. The app is compatible with mobile phones as well as desktop and PC. And we also offer 24/7 tech support through email, live chat, and phone call to make it easier for our seniors to use the service. Some of the app's key features include a match with a professional dietitian to provide nutritional guidance with cultural and linguistic preferences in mind, because we want to make accessibility to our patients our top priority. On the screen on the left, you can see that the app allows people to take photos in-app and upload them directly to their personal food diary every time they eat a meal, because switching between photo-taking apps sometimes can be difficult. We offer printable grocery lists because printing sometimes is easy. You can put them on the fridge to remember what to buy and what to make. And these are tailored to cultural preferences, again, and dietary needs based on local options, which means we take grocery stores around the seniors in mind to make groceries as accessible as possible. And we also consider their budget. Other key features we have are the weekly health check-in questionnaires made of 10 questions to track seniors' habits and improvements as they use our app. And seniors are matched with a dietitian, so they will be meeting them bi-weekly through voice or video call. And in between meetings, they are able to privately message their dietitian through our messaging tab on the left.
So how do we objectively assess patient progress in Eat Right efficiency? Well, Debbie hinted at this in the last slide, but we can do this through our health questionnaire. Every week, our seniors will be taking a health questionnaire that will track things such as their education, their eating habits, and their dietitian match, and their overall happiness with our service. And this will allow us to scale iteratively and effectively into the future.
So in addition to our app features, we have strategically chosen several partners to help us provide the most encompassing care for our patients. After receiving our nutrition recommendations, seniors who have trouble getting to their food can utilize Meals on Wheels, which is a free meal delivery service. Next, we've selected supplement companies, for example, Orgain, which helps tackle the severe protein deficit that millions of seniors struggle with. Ring Central and Great Call are important partners to help our seniors feel comfortable with the technology needed for Eat Right, providing HIPAA-compliant messaging services and phones that are specifically designed with seniors in mind, not complicated iPhones that many of us have probably watched our grandparents struggle with. Last, a huge problem that we noted is senior loneliness, especially if you remember Celia Fernandez's case. So our last partner is Papa, which pairs young people with seniors, providing not only a friend, but someone to help assist in daily tasks such as grocery shopping.
So how do we envision Eat Right rolling out? Well, we envision Eat Right rolling out through a B to B to C approach. This will allow us to tap into reservoirs of seniors who suffer from nutrition-related chronic disorders. We plan on doing this by partnering with independent living and retirement communities and also physician clinics. This will allow us to grow efficiently, lower our patient acquisition costs, and direct our services to those who need it the most.
And we aim to also run a year one efficacy study through partnering with independent living communities for seniors in New England, preferably chains with multiple locations such as Epoch Senior Living Center. They have locations in Massachusetts, Connecticut, and New Hampshire in order for us to reach our first 500 customers. These seniors are unique because they have autonomy over their food choices, often have their own kitchen, and make grocery plans themselves. Some ethical considerations that we take to mind when designing the study is that all users will consent to data collection. The seniors can stop using our service anytime, and all data, if any, used for research and marketing are de-identified, so no personal health information is compromised. Beyond the study, these same considerations apply as patients continue to use our app. To validate Eat Right's approach in the efficacy study, we are gathering changes in clinical outcomes such as weight, blood pressure, and the number of ER visits of Eat Right's cohort versus a control group. And we gather this by reporting, and they will continue working with their PCP as usual. We also collect health questionnaire results, a net promoter score, and patient testimonials.
So the target market that we decided to focus on is 7 million strong. 60 million of Americans are enrolled in Medicare, and 85% of those are 65 and older, bringing us down to 51 million patients. Of those, 64% have Medicare Original or FFS fee-for-service, bringing us down to 32 million. And 21.5% of those 32 million have at least one nutrition-based chronic illness. And that gives us our final number of 7 million patients. For now, 7 million seems small, but this only accounts for the patients that would benefit the most from Eat Right. The actual market could be around 32 million patients, which is the Medicare FFS patients that are 65 and older. So why did we choose to focus on this target market? Medicare FFS patients are one of the most vulnerable to chronic disease exacerbation. This includes low-income Medicare and Medicaid patients. Medicare is also one of the most consistent payers in the country, giving us a solid financial model.
So as we were talking about before we formally started presenting, while there are plenty of companies that are harnessing the power of telehealth, very little attention is paid to the geriatric nutrition space. One of the only competitors that we could find is a company called Mighty Health, which provides exercise and nutrition guidance to people who are 50 years of age and older through a set of personalized daily tasks. So this includes workout videos and nutrition coaching, as well as tailored grocery lists and text messaging with health coaches. They follow a subscription-based model charging $20 a month. So Eat Right differs from Mighty Health in a few ways. For one, Eat Right does not offer exercise advice. While exercise is super important, we believe that focusing our attention on just nutrition for now will help us to create the most effective means of aiding our patients. Now, both companies offer tailored grocery lists and text messaging with health coaches. But it's worth noting that Mighty Health always refers to these people as health coaches, never specifying them as trained professionals, which we find a little concerning. In contrast, Eat Right carefully selects qualified dietitians for our patients. On top of that, Mighty Health requires a subscription fee, whereas Eat Right bills through Medicare. This is important because geriatric nutrition is ultimately an income-driven problem, with the poorest seniors having the worst outcomes, as Sophia mentioned. So our aim is not to target the wealthiest seniors, but the ones who truly need the most help. Eat Right also offers valuable face-to-face video calls with our dietitians on a consistent basis, whereas Mighty Health only offers text messaging, which can be hard for some seniors. And also, Eat Right is the only one to offer a comprehensive means of obtaining nutritional tools. What we mean by that is that not only do we offer nutrition advice, but we also empower patients to actually get the tools they need to meet their goals. For example, our algorithm actually identifies local grocery stores where patients can get their ingredients. And if that's too difficult, partnerships such as Meals on Wheels can directly deliver food, or the young person that seniors can be matched with through our partner Papa can aid them in grocery shopping and other daily tasks.
Let's take a deep dive into our finances. So first of all, as we mentioned, patients are onboarded through the various streams outlined earlier in this presentation. Then they have the initial telemedicine encounter with their dietitian. In this appointment, we can bill CPT code 97802, which reimburses at a rate of $37.69 per 15-minute unit. After that initial encounter, then our patients meet with our dietitian on a bi-weekly basis, where they review their meals for the week and propose recommendations to allow their patients' health to improve. These we can bill with CPT code 97803, which reimburses at a rate of $32.45 per 15-minute unit. Let's assume for simplicity that our initial telemedicine encounter lasts 30 minutes, and over the course of a month, our bi-weekly coaching meetings with our dietitian lasts 30 minutes total for the month. And this allows us, with these basic assumptions, we can forecast Eat Right's finances for the next 5 years. So let's take a look into our costs, especially in year one. These include patient acquisition costs, dietitian costs. We pay our dietitians a wage of $40 an hour, which is $10 above the market value for them. This will ensure that we get high quality and a constant stream of dietitians that allows us to scale with the growing demand for our product. We also have initial costs for maintaining our app, developing our app, and developing the telemedicine platform that supports it, and also managing and training the dietitians. As mentioned earlier, we also provide a 24/7 call center and telehealth assistance platform because seniors are not very adept at telemedicine, but we can help them with that. That brings us to our total costs. As you can see, in year one, we do cut a loss, but after that, we do start to earn a profit and increase our margins very quickly.
So here's a visual representation of our revenues over 5 years. As you can see, growth really picks up around year 3. Some of our financial highlights. So we have a $390,000 initial investment. We're profitable by year 2, and we can see significant economies of scale and cost savings as growth increases. To finish things off, let's bring everything back to our patients. Timothy, who first needed help browsing the internet, now has 24/7 tech support and a professional dietitian that addresses his tech needs and also provides a trustworthy source of information. Matthew, who took the first step on his own with his printable food calendar, Eat Right helped him stick to his goals, provided him grocery plans and guidance by a professional, and it helped him stay on track. As for Celia, who was hospitalized because she was terribly lonely and unmotivated to make her own meals, now has the support of dietitians and Papa companions who we partner with to support, connect, and empower her through health and companionship. As you can see, our elderly patients are now cared for and on the way to a healthier lifestyle thanks to Eat Right. With that, we thank you for listening and open the floor up to any questions.
Very interesting. Thank you for the presentation. You guys have really thought through this well. I can see that from the various problems you've already addressed in thinking through the concept, such as the design and also the partners concept is very interesting. In terms of the question I had was only around the fact that you guys have chosen Medicare fee-for-service and not Medicare Advantage or any other, like you're missing 40% of the population by focusing on Medicare fee-for-service. Any specific reasons for that?
Right, so I can get into that. We decided to focus on the Medicare fee-for-service population, which we know is only 60% of the Medicare population, because we talked to a mentor and billing gets a lot more complicated with Medicare Advantage because they have to partner with private insurance firms. And for our first few years, we really just want to keep a patient focused and target the most accessible and needy patients first. We would like to focus the most on getting to our population, getting them help, rather than focusing on the Medicare Advantage billing. After that, we plan to build out to include other groups such as Medicare Advantage and possibly employer insurance as well.
Okay. Thank you.
Yeah, I think it was a great presentation. You really went through the use case and looked at all the considerations and took them into account. So bravo to that. And I think it does solve a need for that. I guess my question was around all the partnerships you talked about when I'm trying to figure out your revenue model a little bit. And, you know, you talk about hiring dietitians, but then you talk about partnering with everything from Meals on Wheels to other organizations like you've got listed here. When you say partnership, is this something where you would either take a fee or charge a fee for partnering with them, or is it simply a list of recommendations? How do you envision that?
So this is something that the seniors can choose. Like, it's not like every single person who uses it necessarily has to use Papa or Gain or any of that. But we actually, so we also plan to use them as ad revenue. Just, while scrolling through the app, like their ads will be there, providing another like small stream of income. What was the other question? My bad.
Well, I'm just trying to figure out your revenue model. I mean, if you're going to be, now I'm hearing you're going to use that as revenue, as from ads.
Yeah, so again, just to piggyback off Eva, we don't envision those revenues being a major player. They can be a source, but not the main. That's not the pie we're looking at in terms of revenue, right? But yeah, for things like Ring Central, for example, that's how we can provide the two-way text messaging with our patients. That's something that all of our patients would be in. But for some of our patients, let's say some of our patients, Miss Becky, for example, she is old and cannot go to the grocery store. Well, how do we facilitate that? We can partner with things like Papa to help make that a little easier, Papa is, they don't necessarily have an upfront cost. The seniors would just partner with themselves, and we can facilitate that interaction.
So it's not a source of revenue. It's there for the seniors' benefit and are totally optional, but that's the unique aspect that we see other apps don't have. So the means to facilitate the nutritional guidance.
Yeah, with our population, adherence is the biggest issue, right? You see the same thing with medication. Medication adherence is a big reason why chronic condition exacerbation is so big. Same thing with nutritional adherence. That's why we have bi-weekly meetings to hold seniors accountable, right? On a week-by-week basis, and more so on a day-by-day basis when they're like snapping pictures of their meals, right? And this will just bring it to the next level by taking that adherence and really honing in on it by making sure that they can go to the grocery store, by making sure they can stay in contact with our dietitians at any time, right? So that's the main utility of these partnerships.
Oh, I agree. And I think you've thought that through really well. I guess I was just honing in on the price point. Where do you make a profit if you're paying Ring Central and you're paying your dietitians and you're paying that? I mean, does it all?
Yeah, so Ring Central costs are not too expensive, and we factor that into our development and upkeep costs. So that's where all those costs gets incorporated, and we based our costs off of what do health tech startups, especially in our space, generally take on. But yeah, you are right. They do cut into our, especially things like Ring Central. They do cut into our margins a little bit, but that's something that provides so much more marginal benefit to our patients that it's worth it, right? If they can stay in contact with our dietitians on a 24/7 basis, heck yeah, that's awesome, right? No other service provides that.
Oh, I think it's truly awesome. If I can just slip in one more question, what size team do you envision you would need to get this off the ground? In employees.
Yeah, to get this off the ground. So we envisioned, 500 patients in our first year. So we envision our dietitians can take on approximately 40 patients each, right? So that would encompass maybe about 10 to 15 dietitians in our first year.
But how about your actual team, like the people that are selling it, the people that are developing the app, the people that are maintaining the technology behind it?
Yeah, so I'd just a ballpark, I guess. I'd say a team of about 20 people, when you factor things like marketing, when you factor things like software engineers, which we plan to source overseas to get lower costs. That's when we talk to a lot of our mentors, and they mentioned, all these startups, they source their software development overseas just to really get the cost down on that, and that is one of our biggest fixed costs. But yeah, I'd say around 20 employees to start, just a ballpark, and with our dietitians we can scale that up as we grow, right?
Great, thank you.
Hey, I just had one question. First, I just wanted to commend the whole team for, great presentation and really well done. And thank you so much. I had a question about your, the reimbursement model. Do you see any barriers in terms of, the reimbursement model? You mentioned that your competition, doesn't do that. They're obviously charging, the monthly fee. What do you see any risks or barriers in that?
Yeah, I can take that question. Thank you for asking. And the financial model is something we considered very carefully because the purpose of our app is very patient focused. So we did consider if we wanted to make money, we would make it subscription based. We would partner with private insurance, maybe employer insurance companies like Amazon and Google, which Livongo, which is based on diabetes management. That's what they do. But in this case, we clearly see that this is a problem for seniors who need the help. So that's why the billing model comes to mind. And we selected Medicare FFS because they are a reliable source of reimbursement. It's not the most profitable, but it is reliable. And it gets us to millions of patients who we aim to target in our first 5 years.
And no, that's great. And I didn't see anything in the costs around the administration of kind of all that reimbursement process. It's based on that, it sounds like you feel like it'll be pretty seamless to do.
I can tell you firsthand that Medicare reimbursement is not seamless. You have to, they're the people that, they give you the money, no questions asked, but you have to make sure that you don't get audited, right? That's what, we want to integrate into our EMR, which will be on the app itself, right? So every encounter for time-based, where dietitians can log their hours and their time to make sure, everything is by the book, and from there we can bill, and that's encompassed in both our development and upkeep costs and our management and training costs.
Great, thank you.
Do any of our judges have any last minute questions before we let Team 13 go? It looks like no. Okay, well, Team 13, thank you so much. You can feel free to log off if there's nothing else you have to say. Thank you so much for your presentation. And just to let you know, we're having a networking event at 12 to 1, and you're more than welcome to attend that. Let me turn my video on. You're more than welcome to attend that, interact with our sponsors, other collaborators, kind of get to meet the other students. Otherwise, we will be having keynote speaker and award presentation at 1 p.m. So we hope to see you back. Thank you. Bye.
Thank you so much.
Bye-bye.
Of course.
Thank you.
Oh, is my internet connection unstable? Okay. Awesome. So judges, you guys have about 7 minutes to take a little break if you need, and we will begin our next pitch at around 9:30.